Well, Terry, thank you so much for joining us at the virtual education event with Mayo Clinic. For our viewers, why don't you tell us about your kidney cancer diagnosis and experience?
Okay, no, well, thank you so much for letting me share my story and to be here today. So, I was first diagnosed in 2014, so that's a while ago, 11 years almost. I was diagnosed on the 24th of December in 2014 with, I had a 10 centimeter tumor on my right kidney, so that was removed with a nephrectomy. And I was doing really great after the surgery and everything. The pathology came back that I have chromophobe renal cell
Oh,
carcinoma, which is a very rare
yep.
subtype. And so they told me I was good to go. Don't even worry about it. It never comes back. It's not aggressive. You just kind of lose your kidney and move on and have life.
Yeah.
So I did for 5 years. And then I did have metastatic disease to my liver in 2020. So, right during the height of all of the fun COVID things, I went back into hospital and had an open wedge resection done on my liver.
Mhm.
And again, just carried on with life for a while. And then it came back again in 2023, again in July of 2023. So I had an ablation done then. And the first MRI after that, at 3 months, we saw another little spot. We watched
Oh,
and waited. And finally, in March of 2024, we did another ablation on that spot. So since March of 2024, I've been on some targeted therapy medications to control the disease. And I just had an MRI on Monday of this week. And so I am clean and good to go.
hey. Yeah,
Hey,
I'm also a fellow Chromie, so nice to meet you.
hi, good to see
Um,
you.
Good to see you. And that is a thing that I think all chromosome patients have heard that are not stage four, the whole like, don't worry about it. It won't ever come back. Your chances are so low. And then
Right.
and then these things happen. You're like, okay.
Yeah.
So to that point, like what were your first thoughts when you let's go through all of them. What were your
Sure.
first thoughts when you were told you had kidney cancer?
So I was very shocked. I mean, I was young. I was only 41 and I was in really good health, active. I was a runner and did all of the things to stay in shape. I had a pretty decent diet, nothing out of
Hmm.
the ordinary health wise at all. No genetic, no history in my family. So it was pretty much a big shock. And then I think first when you hear like, oh, well, you have cancer, and then you have the surgery to remove it, and then it's like, you're fine. Go ahead, go do what you need to do. It's such a huge one day you walk in and you think you're in good health, then you have cancer,
Hmm.
and you leave and you're like, I have good health again. So it's just a very big roller coaster. And I will say, like, it is very rare for a chromophobe to be metastatic, right?
Yes.
And the
Yeah.
only thing is when it is metastatic, there aren't any particular drugs or combinations of drugs.
Hmm.
When I was diagnosed in 2014, I don't even think my surgeon knew what it was, to be honest. It was not
Yeah.
well known, and there wasn't a whole lot of knowledge of the disease. Now it's way, way better. We still don't have particular drugs that we
Yeah.
can take, or therapies or chemotherapies or immunotherapies or whatever we want to call them. So it is kind of a hit or miss. I think for me, I'm lucky. My first line is doing really great. But through all of that metastatic disease as well, you're kind of lost. And especially for us with this disease that we have, that with not a lot of people having it, not a lot of research on it,
Yes.
until recently, it's troubling to have that diagnosis.
So when that first recurrence happened, what were your feelings? What were your thoughts?
I think, a lot of disbelief for one, because that was like my 5 year mark. And in cancer world, when you hit that 5 year
Yep.
mark, then you're like home free forever. And it was just so crushing and disappointing. But at the same time, more research had been done, and I was finding more things out also about chromophobe, and knowing that it's not as aggressive perhaps as some other ones, something like that. And all cancers in general, right? When I say that, just meaning every cancer in general, not as aggressive. Um, and it's such a small little spot, because I had been doing my MRIs and my CT scans, that when we found it, it was barely a centimeter. And when we took it out, it was still barely a centimeter. So knowing that it was controllable that way, and given my age, then afterwards, we just decided not to do any type of systemic therapy and just see what happens. So a watch and a wait and a watch and a wait. And at that 3-year mark, I was really excited. And then in 2023, again, when it came back, I was like, shucks, here we go again. What's new now? So then you just turn to, in those 3 years, what have we discovered? What have we learned? What are we treating with? What are we doing? What can I do? Are there different procedures? Should I be looking at, a different ablation? Like all of that kind of stuff was available, more readily available, I guess I should say. And it was a consideration then, which ablation is amazing. Highly suggest it. It's way easier than all the other things I had been doing. So yeah, I think every time it's just disbelief and you're disappointed, but anymore, you kind of learn how to work through it and go through it. And it's going to be okay. It's not what you want to do, but it's going to be okay.
Yeah. And where did you look for support and information after your first diagnosis and when you were going through these recurrences and looking at what's out there?
I think after going back, looking at all of my history now, the 11 years of it, I think my first error that I made after being diagnosed was not looking for more support. I feel like I probably missed. But I think being told that this was, a rare thing, it's never going to happen again, just go live your life. I tried to separate myself from that as much as I could. When recurrences began, during COVID and all of that, that's when I started to find different organizations like KCA and connect with people through those organizations just to try to find people who had similar stories as mine. And it's been amazing. There are groups just for chromophobe patients, and then just in KCA, there are other groups, stage 4 group that I'm also in. And, the information from those groups has been invaluable. You feel connected, you feel heard, you feel understood, you're finding resources, it's leading you to good places, not just like, Dr. Google, whatever. It's real legit information that you can understand. And I think that helped me a lot.
So you said that the first time around,
Mm-hmm.
you were kind of trying to separate yourself from your diagnosis, but when the recurrences started happening, you were kind of leaning into it more, if you will. So what changes did you start noticing yourself after the first diagnosis and after the, first recurrence? How did you change?
First and foremost, I think you start to evaluate and what had I done in my life that led up to this point, right? We'll never know. I will never know. I will speak for myself. I will never know. At one point, my body just decided to mutate and go against me, right? So there's nothing. I think I spent a lot of time after that first diagnosis trying to just be hyper vigilant about the way I lived my life, about food choices, about exercise, about all of that.
Mhm.
And you get a few years into it and you kind of let things, I don't want to say slide, but you kind of relax a little bit and you get into that routine. And when that first metastatic disease occurred, I think I took an even deeper dive into what can I do now? Is there anything I can do? And it wasn't so much the physical lifestyle then that I was looking at, or the eating, because I feel like that, the nutrition and the diet and all that, I felt like I had that pretty well under control. I started to really examine stressors in my life, how I handled stress. Was my job too much? Were there things going on that I could eliminate and just allow for me to have extra time in life just to relax and simply enjoy, instead of always having to chase, a better, I don't want to say job, but a better life, looking for things 100% of the time to be correct and all of that. I just really needed to start to let that go. I think that's where I've changed. And I know I said I tried to separate myself from the cancer diagnosis and understand that to be like, I just didn't want to have to think about it all the time.
Yeah,
I felt like for me, they told me I was going to be fine. I'm just moving on. And I think with the recurrences, it's challenging to separate that out of your daily life. It really is, because you are going to think about it all the time. It doesn't necessarily have to mean that you're thinking bad things about it. So I think I've learned that as well. Just because you're thinking about it or you're aware of it doesn't mean that you're dwelling on it. You might be thinking about something that you can do proactively to help, whether it's go have a coffee with a friend or just go for a run or whatever it is to kind of occupy your mind or de-stress a little bit. I think all of those things in my life have changed immensely since diagnosis, for sure.
Yeah. And speaking of those deep dives and those changes, how did your personal relationships change after your diagnosis?
I think a lot of patients in the cancer communities will say at the beginning, so many people are invested and interested and want to help. And then as you get better and you go through surgeries or you go through medications, people tend to not think about it anymore daily, like what you're going through, right? And some people, you're not in the same circles. Like, as a personal choice, I don't drink alcohol anymore. So going to a happy hour for me is not going to be at the top of my list for something that I want to go and join. I will, it's fine. But there are some groups of friends that you have you go to happy hour with them. So maybe you don't have the same circles anymore. But I will say the circle of friends that you do have are the ones that are 100% invested, supportive, and want to be there by your side for sure.
I'd agree with that. And same here. I myself don't drink as well for personal choice and everything. And so you kind of see how things can change when you are living a certain way in a certain lifestyle, how like those dynamics change. But you're right, the people who are with you and the friends that are with you, they feel like they're there for life and they're just gonna like help you through anything.
Mm-hmm.
So, what helped you maintain those relationships through your diagnosis? Like, how did you turn to them? How did you seek support?
There are just some people in your life that you can always count on, no matter what. And I think that's who you're kind of left with. And then the people who are really you can and you can tell, they're the ones who continue to ask you questions, and when you explain and when you answer the questions, they will listen and they will ask you more things. They're the type of people who don't necessarily they show up at your door with something to eat to cheer you up, or they offer to take your children to the playground after school, those types of things. And I think you have to be open to anyone who's interested in helping you, and you have to allow yourself to be open to accept that help as well. And that's something that's been super challenging for me too. I'm just like a type A independent lady. I can do what I need to do. But
Yeah.
it is challenging to accept help from others too. But if people want to, those are the people that are going to be near you always.
What were some tools or strategies or ways in which you allowed yourself to accept that help, despite like your body screaming, "No, I could do it on my own"?
I think it is really challenging for some people who are built like us, because when you're going through this diagnosis and through the treatments and things, you really just want control. And so to let go of control is another thing. It's a whole new thing for me. But just little by little, I think you notice that if someone does the grocery shopping for you instead of you having to go to the grocery store, it's perfectly fine. It works out great. They bring home the same things that you needed. So that's okay. And that allows you that time to just relax and do something that you enjoy instead. You don't have to be in charge of everything. So you just have to know that that's not a weakness to accept people's help. It's actually a really great sign of strength that you're allowing to recognize that you do need help and you can accept help from others.
Absolutely. And I think that's great advice. And going on that line, what other advice do you have for people who have been diagnosed with kidney cancer?
I think just get connected. I follow the social media groups, Facebook and Instagram and all of that. I very rarely post. I will comment if I feel I have something of value. So even if you're signing up in these groups, you can control how much you want to see or not see. But the connections you can make are incredible. You can have these friends, then when you've got something to ask, you throw it out there and people will answer you in spades. It's amazing at how much information and how much connectivity and support you can find from those types of groups for sure.
Yeah, and I do think there's something that just binds cancer survivors together.
Mm-hmm.
It's this kind of unspoken bond when you make those connections with people, even if they're not necessarily deep or they're not like your best friend or something. They're still across, I think, all cancers. There's just something about meeting another survivor and another patient where you're like, you understand me. Like, I don't even have to say a word and you know why my face looks like this, or you know why I'm feeling nervous about a scan. Uh,
Yes, because I think unless you are the actual person who's sitting with the medical staff and it is your life and someone says to you, you have cancer, you really don't know. You can be the best person in the whole wide world, but if it's not you, if that has not been said to you, you really don't know what goes through a person's mind. But all of these people who are connected in these groups, or other, however you meet the people who are walking through cancer or kidney cancer or whatever, they will know exactly how you feel on the day when you're having your scans done, or if your blood test looks a little wonky. Like, they understand that's hard for you in a different way than someone who's not walking in this cancer path knows.
Yeah, and there's just something about having that understanding that makes this experience easier in a way. But
Yes.
Teri, thank you so much for joining us. Before I let you go, is there anything else you would like to share with our audience?
Just keep living and going every day. That's what we get to do. And we make the best of it. And this is a great life that we have. So experience everything and enjoy everything.